In this video series, I'm going to teach you the essentials of medical billing and coding for interns and residents. This is a really important skill to have to make sure that you're getting paid what you're worth and making sure that your patients then are getting the best care possible. By the way, I am Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. Now, if you're not an intern, a resident, or maybe even an advanced practitioner that didn't get any knowledge of medical billing and coding through your education, and you're just someone who's looking into medical billing and coding as a career, go to my free medical coding masterclass at medicalcodingmasterclass.com, and that will give you all of the information about what boxes you need to check off in order to start your career as a medical biller and coder. It will give you that full roadmap of how you go from someone who has no background in medical billing and coding to being someone who's job ready in medical billing and coding in as little as 6 months. It just takes away all of that guesswork, and then it tells you about the program that I've found preppy that will give you everything you need to be successful in a career in medical billing and coding. And it's at your own pace and very affordable. So definitely check out the free masterclass at medicalcodingmasterclass.com. I'll also link it in the description below. Now, in order to understand medical billing and coding, one of the first concepts you're going to need to understand is insurance. So let's talk about the different types of insurance. First and foremost is Medicare. Medicare is available to patients that are 65 and older, and then there's certain qualifying medical conditions that patients may have Medicare for as well, such as end-stage renal disease. It's federally funded, it's very heavy regulated. There's a lot of different audits and checks and balances that go on in the Medicare program. And there are 4 different parts to Medicare: Part A, B, C, and D. Medicare Part A covers your inpatient hospital stays, patients that are admitted to the hospital and paying for things like their room and board and usage of the staff and the medications while they're in the hospital. Medicare Part B is for your provider-based services, your preventative visits, your office visits. If you're having things like a surgeon do a surgery on you, that's all covered under Part B Medicare. Medicare Part C is those replacement plans, those plans that even though that patient is maybe 65 and qualifies for Medicare, they want, I want something that's going to cover a little bit more, be a little bit more robust, maybe has a better network, better coverage, and they've elected to pay for a replacement plan. Actually, over half of Medicare beneficiaries elect to go into a replacement plan, and that's expected to kind of go up over the years. And it's because they get additional things that maybe Medicare doesn't cover. Like, for example, Medicare doesn't cover a traditional head-to-toe physical exam. They cover like a wellness exam, but they don't actually cover like that head-to-toe physical that you traditionally think of. So more and more patients are electing to buy a Geisinger Gold or a Senior Blue or a Highmark Blue Journey or whatever they call some of these replacement plans these days. And sometimes they get these cool perks like Silver Sneakers. If you've ever heard of Silver Sneakers, it's a gym program where maybe as part of their package they can go to their local YMCA and work out, and that's included in their Part C plan. And then Medicare Part D is for prescription drug coverage. Now, there's a lot to manage with Medicare. So CMS is the Center for Medicare and Medicaid, which we'll talk about Medicaid, Center for Medicare and Medicaid Services. And they have these regional, what they call MACs, or Medicare Administrative Contractors, that kind of help manage certain regions. So these Medicare contractors, these MACs, kind of take Medicare regulations, maybe areas that are gray, and kind of help interpret them and how they're going to implement them in that region. So you may see slight differences in policies based off of region. And that's why it can get confusing if you go to, for example, a large provider conference and you meet someone there who's in a different region. They might say, hey, I bill this out a certain way and it gets covered, and you might not be getting coverage for that in your area, or you might have to use a different diagnosis to get it covered, or they might be getting it covered with a diagnosis that you're not getting it covered with. It's because of some of those different regional differences. And we see that with our commercial insurance programs too, which we'll talk about. Now, I mentioned Medicaid. Medicaid is a program that is for people who don't meet a certain income threshold, usually are low income patients, and oftentimes state programs have Medicaid programs that will cover children that don't have insurance otherwise as well. And also some patients do qualify for Medicaid based off of various disabilities that they have. Medicaid is always the last and final payer, so if a patient has any other insurance that may pay first, Medicaid will always pay last, and unfortunately, they also pay the least. That's why you see some providers that opt not to take Medicaid patients because they don't get reimbursed very well for a lot of those services. There's also TRICARE. TRICARE is for military service members and their dependents. And then we have what we call our commercial insurance plans. Those are your Highmark, Capital, Cigna, UHC, Aetna programs out there. And it does include programs that you can purchase from the Affordable Care Act marketplace. But of course, most of them are programs that patients get through their employers. Some of these programs can have very high copays and deductibles, so let's break down some of those terms. So a copayment is a payment that's made when a service is rendered and the patient is responsible for that. Things like an office visit might be a $20 copay that the patient has to pay. Or if they're going to urgent care, it might be $50. If they go to the emergency room, it might be a $100 copay. But then certain things like preventative exams, oftentimes insurances want you to have those. So there'll be a $0 copay if you go for a preventative exam or an annual GYN exam. And the copay does not count towards the patient's deductible. The deductible is the amount of money that a patient has to pay every single year before their insurance will start to pay on services. Some patients have ridiculously high deductibles, like thousands of dollars each year. If you've ever gone on the insurance marketplace, you can see there's lots of different programs available, and oftentimes they have these ones that are very high deductible because that patient doesn't have to pay as high of a premium for that insurance. That's like their monthly payment for having that insurance policy. So maybe they only have to pay, $80 a month, but they've got a $10,000 deductible before their insurance will pay for any other services. Or sometimes they work with an employer that just doesn't have a great coverage. They kind of cheap out on health insurance. So, if that patient has a high deductible of $5,000 and, their kid falls out of a tree and they think they have a broken bone and they go to the emergency room and get all kinds of x-rays, they could easily be out that entire $5,000 deductible just for that one trip. And remember, it's yearly, so if they go all through almost the entire year and then at the end of December, their kid has an accident or they get really sick, and then it happens again January 1, maybe they have to go for follow-up testing, they're going to owe $5,000 in December, and then when that resets in January, they're going to owe that other $5,000 again. And then we have coinsurance. Now, coinsurance is very different than the copay or the deductible. So coinsurance is a percentage that a patient is responsible for a covered service once they've paid for their deductible. So let's say you go in for an office visit. The office visit is $100 and the patient's coinsurance is 20%. So let's say a patient's health insurance pays $100 for an office visit, and that patient's coinsurance is 20%. If they've already fulfilled their deductible, they'll be responsible for 20% of that $100 or $20. The insurance company will pay for the remainder of it, that 80% or the $80 of that $100 visit. Now, if that patient hasn't paid their deductible yet that year, then that whole entire $100 is going to be patient responsibility because that's going to go towards their annual deductible. Now let's transition and talk a little bit about some of those special permissions that an insurance company looks for. Let's start with referrals. So some insurance companies will say, hey, if you want to see a specialist, you first have to designate a primary care physician and have them refer you over to the specialist. So if a patient is having some sort of problem with their sinuses, they can't just go right to the ENT. They have to go to their primary care physician, say that they're having issues, and the primary care physician has to refer them over to an ENT. And then we have prior authorization. We see this a lot for things like if a patient has to go for an expensive surgery. The insurance company wants to know about that ahead of time. So they want all that information submitted to them. What diagnoses does this patient have? What service are you planning on doing? And then they'll kind of look at it and go, is this something that we're going to cover? Or they might say, hey, have you tried maybe these less expensive, less invasive procedures prior to us just going ahead and covering for this really expensive surgery? So maybe they might want to see some documentation that a patient had injections in their knee, or they tried physical therapy before they jump right into a joint replacement. So someone will need to either call or go online and submit the diagnosis codes, the CPT codes, and get that prior authorization. And as the insurance companies like to say, they're not denying the patient has that procedure, they're just denying to pay for that patient's procedure. And worth noting, it also gets tricky if there's a change to the planned procedure. Like maybe we submitted everything with codes for a laparoscopic surgery, but then the patient had adhesions or there was some sort of problem, we had to open them up. That's a different CPT code. We'll talk about coding in the next video, which means that prior authorization was for something different, and that can cause a bit of a mess on the back end trying to get that corrected. And insurances also have coverage policies, so just because a patient has insurance doesn't mean that everything under the sun is going to get covered. And even if it is covered, there might be certain stipulations. Oftentimes you'll see they have covered diagnoses. So an insurance company might say, hey, we cover for this procedure, but only if the patient has one of these diagnoses on this list. One example could be if a patient has an eye lift. Eye lifts are done a lot of times for cosmetic purposes. So a medical insurance isn't going to cover a cosmetic procedure, but there's lots of non-cosmetic reasons that a patient might have an eye lift. If their skin is drooping into their eye and obstructing their vision. Oftentimes in those cases where there's a medical condition that's documented very well, we've run visual field tests, we have all the paperwork saying, hey, you know, this is not a cosmetic one, it's definitely medically necessary. Medicare, for example, will cover those if they meet that qualifying criteria. But we need those formal assessments. We need the documentation of the formal assessments, and that'll has to go to them to look over and approve it. Because unfortunately there have been in the past and will continue to be in the future providers that abuse the system. And another thing to note about insurance companies is that they don't always necessarily cover the exact same things across the board. So one patient may have a policy with an insurance that covers something like bariatric surgery, but another patient might have coverage through that same insurance but has a different policy where they carve that out and they say, we're not going to cover this, you know, we just don't want to have to pay for that. And that could be because maybe their employer carved it up. They said, hey, we want a cheaper plan, and so let's take this out and this out and this out, and we're not going to cover those so we can get the cheaper plan. And so even though maybe both of them have Cigna or both of them have Highmark, because they have different policies, one of them might get covered for a service, another might not. Now in the next video, we'll talk about the different medical code sets and how those play into coverage, documentation, and payment. But in the meantime, don't forget, if you're interested in a career in medical billing and coding, which is a very popular work from home position, I will say you can go to my free masterclass at medicalcodingmasterclass.com to learn all about the career information for medical billing and coding. In the meantime, don't forget to like, share, and subscribe. I will see you guys in the next video. And until then, just keep on coding on.